Dr. Danny Governor here, SD Body Fix. Have you ever had sciatica? I know I have, and it's miserable. Today I want to talk about why sciatica happens, what causes sciatica, and then I want to give you a really simple tool to manage the pain and discomfort of sciatica. So a lot of people think that the sciatic nerve just gets pinched or compressed. Yes, that can happen. We can have a disc bulge, we can have a disc herniation, we can have a bone spur, we can have just muscle tightness. But a lot of times what happens with the sciatic nerve is it just has too much tension on it. Think about like when you're watering your lawn or you're watering plants around your house and you're taking the hose and it gets stuck on the side of the house and it gets stuck and it just won't glide. That can happen with the sciatic nerve too. There's a lot of structures that it passes on the way down your leg. So there's a technique called nerve gliding or nerve flossing where we can get that nerve to glide and move a little better. This will reduce the irritation and the inflammation, hence decreasing pain. Today I'm going to show you the simplest form of this. There's many options for getting the nerve to glide, but I'm going to show you a simple way when it comes on to try to decrease the symptoms and pain of sciatica. Here's how you do it. First, we're just going to get on our back, all right? Now, we want to be real careful. A lot of times people think that stretching your hamstring is what needs to happen. People feel this pain and they want to stretch, stretch, stretch. That actually makes it worse because what's happening is you're pulling on it, okay? So you don't want to stretch the hamstring aggressively, but we do need to use that to our advantage, that movement. So here's how you're going to do it. Let's say you're having sciatic pain in your left side. So we're going to start with the bare minimum of how to get that gliding. And the way we would do that is we would relax the foot and just gently extend the leg. We're not going fully straight. That's going to stretch it too much. We're not doing that yet. We're just going to slowly extend, and we're going to go back and forth. Here, we're just slowly gliding that nerve, just causing a little bit of tension on it. If you feel pain, back off. We want to be just behind that pain. Give it about 5 reps. If you still feel it, then go even less. If you don't, go a little bit more. So then we'll start extending a little further. Here, we're starting to glide and pull on that nerve a little bit more. If you can do 10 reps of this without pain, numbness, or tingling, then we'll start to flex the foot a little bit towards the head. That's really going to start tug on it. Once again, we want it to be relatively pain-free. So this is how it looks. Interlock your fingers, and then we're going to really start pulling it like this. Now, some of you are just going to have tight hamstrings in general. It's okay if the leg doesn't go completely straight. It doesn't matter. Another note, if it's really painful, you can actually go to the other side. So even though you're having pain here, you can use the other leg. Because remember, those nerves come together into the spinal cord. So just pulling on this side is actually getting this side to glide too. I would do it multiple times a day. Start slow, then start to hook, 5 to 10 reps. And then I bet if you do this for a few days straight, you'll be surprised. You'll start to see decrease in pain right away. Give it a try.